I'm so happy to be here today to talk about marketing in this changing home health environment. And there are so many changes happening not only in technology but also within home health care that it's really consider this a heads up or sort of a warning or some type of an alert that things are changing, and that as a home health agency, to survive in the future, you are going to have to start considering marketing when you may not have considered it in the past. My name is Merrily Orsini, and I am proud to work with Axxess in a business development capacity, but in my full-time job, I work in marketing, and I have helped agencies. I've been in the home health industry now for 35 years, and helping agencies succeed is one of the passions that I have, and an understanding of marketing is what I can bring to the table in terms of helping your agency succeed. Today we have 3 objectives, and hopefully I will accomplish those, although they're pretty big objectives. But I really want you to understand that there is a new target for marketing. It's not the traditional referral sources that it used to be. There really is a new target. The other thing that's changing is the technology. Digital marketing strategy is something that home health agencies do need to learn about and start becoming familiar with, because it will be important as we continue to consolidate in this industry, and as we continue to have changes. It will be very important to understand a digital marketing strategy and how you can start applying that within your agency. I'm also going to touch briefly on the psychology behind the search for home care services, because again, in the past that's not been the case, but now that the target is changing, some of the psychology behind the search for services is also changing. This really reinforces what I said before in terms of the changes. We really have a disruption of the old model where we are slowly moving into value-based purchasing, and I say slowly, actually not so slowly. This is 2016, and there are 9 states now in a pilot program mandated to provide statistics on the value-based purchasing, and they will be reimbursed later on how they do rank based on their benchmark year, which the benchmark year was 2015. So we are full into value-based purchasing for those 9 states, and we fully expect that to go across all 50 states in the near future. Traditionally, and I just mentioned this briefly in my introduction, but traditionally selling Medicare home health services had a specific target, and there was a way that it happened. And there are so many new models now out there that really have to do with partnering. There's ACOs, there's medical homes, there are bundled payments, there's value-based purchasing, there are all kinds of partnerships now, insurers, MCOs, there's different partnerships now that are coming together. And home health, because it is the least costly option, is an option that most of those partners want to have as their service offering. So there really is an opportunity now for the home health agency, the smart home health agency who is innovative, and the smart home health agency who wants to stay in the market and be successful. There really is an opportunity at this point if you understand marketing. Now, what's happening is you're selling to a broader model, a broader base, a broader consumer base. And so where traditionally you had a tight target market, and it was a salesperson actually going in and working with a specific referral source to get referrals, we're moving up market, as I like to say. There's lots of opportunities, but the people that you're selling to are not going to be those same referral sources. Eventually, I think, because of what's happening with value-based purchasing, some of the consumer perceptions are also going to come into play in selecting services. So that is the value-based purchasing model, and the model that you really do need to think about in terms of how are you going to go to market with your home health company. Marketing strategy is something that is really pretty basic. It starts with knowing who your target is. It then goes into using visuals and messages to reach that target. And the third thing is really understanding what channels should you use to reach your target market. So pretty simple strategic concepts, but changing, as I say, because of technology and because of how the industry is changing. So in the past, home health agencies have really not had to worry about their visuals or their messaging. They've pretty much sold to a tight market. And as that moves into more of trying to attract a C-suite executive or trying to attract a consumer, that will change. And branding is going to be something that I'm not going to talk too much about today, but branding is something that's the starting point. Branding is really the who you are, why you are in business, and what sets you apart from others. And branding is going to be important in the future for the successful home health agency. When I say that the home health market is going to become eventually more of a consumer-based market, it will be a consumer sale, because as home health really becomes more integrated in the larger healthcare delivery system, as more people understand how home health can help them reduce their bottom line, there will be many opportunities for home health to join with other partners to start selling their services to a bigger audience. It's a larger sale, and but it also has some risks that go along with the bundle payments and sharing risk that is not traditional for home health. And that's a topic for another webinar, but basically understand that there will be opportunities for new partnerships that may not be even available today, but starting to understand how you brand yourself, how you differentiate yourself, and how you move into that larger market will be very important for the home health agency of the future. Now, today, and I'm saying 2016 because technology changes so rapidly. If you watch this 2 years from now, we may be in a totally different place. But so I'm not really trying to predict the future, but I am saying today I'm seeing the sales move more into that C-suite executive level. And reaching that higher level decision maker is probably something that hasn't been in the toolbox of the salesperson for the home health agencies of today. So it really is reaching a different market, and again, thinking of you're not only reaching a C-suite executive, but in the future, what you do, because of the reporting mechanisms that are now in place, the consumer will start having a say in which home health agency is chosen for their parents, for their loved ones, for their spouses. Now, this is what's changed in technology. This is the technology change that is really making the difference. And these micro-marketing moments never happened before. And what I mean by micro-marketing moments is that consumers have at their fingertips 24/7, 365, a variety of mobile devices. And we are seeing the search for services, the search for products really increasing dramatically and rapidly because of these micro-marketing moments. So when someone has a thought, they can go directly to their mobile device and they can search. And that search process is more and more what people are doing prior to making a decision, prior to making a phone call, prior to researching more in depth about something. They are using these micro-marketing moments, and that's the opportunity for digital marketing that the home health agency really needs to be aware of. So you're still going to have to do the things that you always had to do. There still are viable sales options for the home health salesperson. So some of these things, the important factors I'm providing here on this slide, but it is truly you have to do what you were doing in the past, and then you also have to think about what you need to do in the future. And the one thing that's on this slide that has not been of importance is the customer service. Having a unique and a positive customer service experience has not been, again, in the toolbox of the home health agency. So that is something that, and we're not going to cover that today, but it is something that you also have to be aware of in the future. The other thing is the chronic disease management. That is something that's coming up in the future as well. So that is most of our population has chronic diseases, although we are in a post-acute care provider in the home health industry. Chronic diseases are certainly something that everyone is noticing is happening to the aging society, and as society ages, there will be more chronic diseases, and we have to learn how to deal with those. So to stand out from the crowd, and what's happening with value-based purchasing and our 5-star ratings and the CAPS questionnaires. What's happening is we now have data available, and that data is on a comparative level. So people are starting to look at that data and are starting to compare agencies. So you really do have to take the metrics from your agency and learn how to present them graphically. A sheet of paper with statistics on them doesn't work. Home Health Compare is certainly a graphical representation, but in learning how to use the metrics to help sell your services to that C-suite executive, you are going to have to learn how to showcase your metrics in a way that puts you in someone's eyes as a successful home health agency and someone that they would like to partner with. This is just another really slide for two reasons. One, to show you interesting ways to showcase metrics is one of the reasons for this, but the other is really to showcase what Caring.com and Forrester Research are showing for people, the consumer who is searching for home care services, and how much of that search is done online, done digitally. So again, as home health moves into upmarket and starts trying to reach the consumer and the C-suite executive, they're going to be looking where everyone else is looking, and that is online. And if you want to showcase your metrics, you have to do them in a way that will catch someone's attention immediately and not just bore them to death when they look at the page. So I'm going to just reinforce again about the strategic marketing. I talked about that earlier, but you really do have to know who you're targeting, and that is key. So if you are targeting that C-suite executive or the consumer, then you really do have to focus your marketing efforts digitally on those targets so that you are speaking to them, thinking about what they might be looking for in a partner, and these are the things that you need to do to be successful. Some of the agency positioning that I'm suggesting here on this slide is basically you want to be a preferred provider in some of these managed care reimbursed states. You want to be a partner in payment. You want to help share the risk in reimbursement for your partners. And you want to be able to justify that you can do that with numbers. And there are two things here that are very important for the future. One is you want to show that you are innovative, and the other is you want to show an ability to scale. Because if you think about it, as you move into a market where someone is going to partner with you, they're going to want you to be able to scale up. If you're a very small provider, then you need to be a niche market provider because you really do need to provide something that no one else provides in order to gain someone's attention. So how do you go to market with the future in mind? I mentioned branding, and having a brand is really important, and that is the #1 starting point. So the brand is based on why you're in business, what you do, what your unique offering is. We call it your unique positioning in the market. What is that, and how can you best present that so that someone easily understands it? I will say in marketing, less is usually more. So long lists of services and long, busy pieces of information are really not what people are looking for. They're really looking for a quick way to find out what it is you do and how are you different from other people. And again, that is the starting point for your marketing. So what is the larger market going to be looking for in your home health agency? They're going to be looking for someone who is improving their quality measures and who is stacked up as one of the best against the competition. You might be asking yourself, so how is it that I reach that larger market, and how am I going to reach that C-suite executive? Well, the main thing will be your online presence, and that online presence is your website, your social media, and other things that you might want to do online, YouTube channels. Some of the home health agencies are even using Pinterest. So going online where people are searching, that is really the first thing that you have to realize you're going to have to do. The second is publicize, and you can publicize using traditional media, or you can publicize using the online media, and I would really recommend both, but you have a wide way to publicize your wins, to publicize your numbers if you're having positive numbers online, so you can share that information across channels, and you can post it in a lot of different places, and you can celebrate your successes online, and also that'll showcase your differentiation. The third thing is the psychological aspects of the buyer. What's behind that searching process? What's the psychology of the buyer? And as you move more into a consumer-driven market, some of those psychological factors come into play. And they're looking for a solution that will make them feel better, that will help them feel less guilty for reaching out for help, and that will help them know that someone will care for their loved ones the way that they would like that care to be provided. The C-suite psychology, again, the C-suite executive is going to be looking for who's going to make the best partner for me. Is that home health agency a quality service? Can they prove that they deliver a quality service? And do they have the capacity to scale? That's going to be very important, because if you move into a larger organization that's providing services to their population, then you're going to have to be able to provide those services to that increased population. And the other thing is innovation. Are they innovative? Are they practicing operational efficiencies? Are they using telehealth? Are they trying to cut costs and cut corners and still achieve that triple aim while they are providing better patient care, but at a lower cost? Now, I get questions about search engine optimization, which in the industry we call SEO. And should an agency use SEO on their website? If you were reaching a larger consumer market, then yes, SEO would be important. But what you have to think about is who is searching for the care. Right now you're trying to reach that C-suite executive. So you're still going to have to use some digital marketing tactics. You would have to use some blogging, social media tied into your website, and you would have to push the niche market capacity that you have and your differentiation. So in those ways that you can use SEO. But the consumer right now is not searching for the most part for certified home health agencies, but again, that may be something in the future. And as the consumer market grows, you want to have your SEO in place. And search engine optimization is cumulative, which means that if you build the website correctly and if you use your content correctly, then you're never going to be penalized in terms of being ranked in search engines. So everything you do to enhance your search engine to optimization will help you in the future. So you're not going to spend money wastefully if you spend money on search engine optimization. That C-suite executive, though, is probably going to be searching by agency name or going to be searching by niche market capacity or what they need to fill out their services. So be cognizant of that as you're developing your search engine optimization tactics. So what should you have on your home health website? You really, first, as I've said, you have to have a good brand, and you want to extend that brand, and the website should be able to do that. The other thing that would be wonderful is if you have a HIPAA compliant intake form, so that a physician or someone who has a specific request for an admission can actually do it through the website. That would speed up the process, and that would also set you above the competition. You also need to showcase any current partnerships that you have, any innovations in care, and also, go back to showcasing your capacity to scale, because that's what the C-suite executive or someone who's looking to partner with the home health agency will be looking for. And again, they're searching online. So if you don't have a website that meets these criteria, then you need to start working on that. I'm just going to briefly mention search engine optimization versus pay-per-click, because most people don't know the difference. And pay-per-click means that you are purchasing words and you have campaigns that you pay every time someone clicks through to your website. Pay-per-click is only good for the search that is immediately happening. There is no cumulative effect to pay-per-click. When you quit paying for that pay-per-click, then there's no residual benefits to it. There are residual benefits to search engine optimization, so I really only recommend pay-per-click if you have a specific reason to do it, and an event perhaps, or you're introducing a new service or something that you want people to come to your website for based on one specific thing. And realize it's not cumulative. Your dollars are most well spent on a search engine optimization effort, not pay-per-click. I mentioned this before about search engine optimization. It really starts at the beginning. How your site is built. You should build it on a content management platform. We recommend WordPress simply because WordPress started as a blogging platform and search engines really do seem to like it, but you do need to start building that website with SEO in mind. And you also have to maintain it regularly. That's where blogging is so important, because every time your website changes, that alerts the search engines to parse your site, and that will help you in your search engine rankings. So there is authority that the search engines are looking for, and your website needs to be built well, and you need to always be pushing with the content that will help you gain authority in search engines. I'm going to leave you with a statement here, because data and measurement of quality rule in home health. And it's how you showcase your data and the measurements of quality that you have that will mean whether or not you're going to succeed in the future or whether you will be left behind. So, what are your next steps to success? I think it's been pretty clear from what I've said today. You need to stand out, you need to showcase results, you need to be innovative, and you need to have an ability to scale your operation so that you can become a part of the larger healthcare delivery system. Now, if you have any questions, feel free to contact me if you have any questions about this, or of course you can always contact Axxess and get to me through Axxess. Here's a slide on the corecubed component of what I do, and my contact information is there. Thank you so much for your time today. I hope you've enjoyed this, and I look forward to presenting other marketing information to you as this industry changes. Thank you.
Thank you for joining our webinar today. We know that your time is valuable and are happy you chose to spend it with Axxess. At Axxess, we're proud to offer a variety of training resources to keep you in the know on industry news and updates. You can register for additional trainings and watch on-demand training videos through our software or at Axxess.com, where you can also find tutorials, online manuals, and answers to frequently asked questions. We're always just a call or click away. Feel free to call us at 866-795-5990 or email us at support@axxess.com. All of our expert client experience representatives have a home healthcare background. They've been in your shoes and know the industry inside and out. Join the conversation and connect with us on our social channels. We'll keep you up to date with what's going on in the industry and share resources to help you grow your business and improve your patient outcomes. Thank you again for your time today and for choosing Axxess, your provider of complete home healthcare services, software, and solutions.